For my patient's initial assessment, I'm going to be assessing his internal rotation of the shoulder. He currently is in 30 degrees of internal rotation. I'm going to be performing a lateral glide on my patient, and it will be a grade 1 because he is starting his rehabilitation program. This will help increase my patient's range of motion for all motions of the glenohumeral joint. After performing the joint mobilization, we will reassess my patient's internal rotation. My patient now has 40 degrees of internal rotation. This will be a sleeper stretch for my patient, and he will be in a side lying position, and the bottom arm is going to be the stretching arm, and the other arm is going to passively put the stretching arm into internal rotation. And this should only feel as a stretch, not any pain, and the patient will engage this for 2 sets of 30 seconds each. This next exercise is called prone retraction and depression. So the patient is going to be in a prone position, and he's going to be instructed to retract and depress his scapulas. A good cue for him will be putting his shoulders into his back pockets, and he will engage in this exercise for 2 sets, 10 reps each, and this should not cause the patient pain, only strain in the muscles that are being worked. This last exercise will be the quadruped series. The patient's hands will be under their shoulders and their knees under their hips. Then they'll have a TheraBand around their hands, and they'll take one hand going from a medial to lateral position and 8 times, going from a neutral to superior position 8 times, neutral to inferior position 8 times, and then circumduction going both directions. This should not cause the patient any pain. There will only be a strain in the rotator cuff as well as the rhomboids and middle trapezius muscles. Once the patient is done performing this exercise on his right arm, he will go and engage in this exercise on his left arm, and he will do this 2 sets.